Historically, the number of open aortic procedures has been decreasing nationally in the United States, and we became interested in using the SVS VQI registry to evaluate, number one, what the volume of procedures looks like over recent years. And over the last few years, the VQI has started collecting data about the level of trainee that participates in any particular procedure and what their level of involvement in the procedure is. And so we wanted to use those new variables to get an idea of who is actually doing the procedures at academic institutions and compare the outcomes at these institutions based on the level of trainee and whether a trainee was involved.
We stratified a couple different ways. We looked at cases with and without trainees, and then we looked at different institution types, whether they were an academic training center, whether they were kind of a non-academic teaching hospital, or like a privademics type practice, and then if they were more of a community type practice, and compared the outcomes of EVAR, complex EVAR, and then open aortic surgery with and without trainees. Overall, we didn't see significantly worse outcomes with trainees involved. In fact, they were relatively equivalent, and we saw a small potential protective effect or association, I should say, when trainees were involved in open aortic surgery.
First of all, a lot of this is kind of confounded by the fact that the big aortic centers are where the majority of open aortic surgery is being done, or at least that's our perception in the country. And of course, the SVS VQI is not complete capture of all aortic repairs in the country. We think it's a fairly high capture because especially at academic centers, because those are were the early adopters of the VQI. But interestingly, really, if you break it down by the three types of centers that Joe just pointed out, academic centers, sort of what everybody calls privademics, where that's more of a community practice where there are residents, and non-academic centers, it's about a third in the VQI. So we get a pretty good comparison despite it not being complete capture. And we would assume that the higher volume centers would have better outcomes in general, because that's a fairly well-known finding in open aortic surgery. There's a known volume outcome there. All of that said, I think the important things, the upshot of all this is that having a resident participate in your surgery is not a bad thing. In fact, it may be a very good thing, because you have more eyes looking at you, you have more people taking care of you around the clock, and it really demonstrates the importance of surgery trainees. The dissemination of more complex endovascular technologies into the community has made the skill set of open aortic surgery decrease in general, and so over time it's going to continue to collect at these larger academic centers. So the fact that we get as good or maybe even better outcomes at these centers that have surgery trainees is perhaps highlights the importance of centralization of care when you have these more complicated procedures and a decreasing skill set.
As part of our case volume analysis, there were still hundreds of open aortic surgeries at different centers, both with and without trainees currently, that did not have trainees present in the case. And I think those at least offer some opportunity for expanding some training opportunities and exposing more future vascular surgeons to open aortic care.
There are a lot of places in the United States where they do not have training programs, where they have high volumes, and they probably have surgeons who would be happy to teach. And I think that those are opportunities in the future for people to start training programs, especially fellowships. I understand sometimes the reticence to start a residency just because that's a bit more of a challenge, teaching somebody to be a surgeon from beginning to end. But having people come from a general surgery program who are really essentially at finishing school that you're going to teach how to be a vascular surgeon it's really a lot of fun. And I would encourage people in the community who have high volume practices that span all of the things we do and have open aortic surgery as an opportunity, they should consider starting training programs.